This video is aimed at doctors, nurses, midwives, phlebotomists and medical students that need to take specimens from inpatients. Having watched the video, you will understand the importance of positive identification of patients. You will understand the importance of scanning the patient's wristbands. You will know how to print specimen labels. You will know how and when to print and complete requisition slips. And finally, you will understand the importance of marking samples as collected. I need to take some samples from one of my patients on ward 3A, Mr. Bruce Sinclair. Here I'm in PowerChart and have highlighted my patient's name on my patient list. Equally, you might use the doctor's work list, whiteboard or care compass. You could even search for the patient by MRN, but if you do this, be sure that you select the correct inpatient encounter. Next, I select Specimen Collection from the toolbar. The Specimen Collection window opens and I'm now ready to positively identify my patient. Alternatively, I may wish to find my patients from the phlebotomy list. To do this, again I'm in PowerChart, but I would select Collection Run from the toolbar. The Collection Run window opens and I can then search for my ward or choose a ward I have visited previously, in this case 3A. I select View Collections and I'm then shown a grid of all the patients on this ward who need specimens collecting. Select Record Collections for the appropriate patient and you are now in the Specimen Collection window and again ready to positively identify your patient. From this point onwards, the workflows are identical.
Hello, my name's Leslie. I've come to take some blood from you today. Can you just confirm to me your name and date of birth?
Yeah, it's Bruce Sinclair and I was born 2nd of May 1953.
Thank you, that's fine. I'm just going to scan your wristband now so that I can check what bloods are due to be taken today. There we are, they've come up on the screen now.
If the wristband you scan matches the record you have open, then a list of specimens to be collected will appear. If the patient in front of us was not Mr. Bruce Sinclair, then scanning the wristband of that patient would alert us to the fact we had the wrong patient, and you would see the following message on the screen. You can see therefore that scanning the patient's wristband will prevent you taking specimens from the wrong patient. Now that we're sure we have the correct patient, we can see which specimens need collecting. In this case, there are 4 specimens, and we can see exactly which bottles we need to use. We can also see which specimens, if any, will require a requisition slip. In this case, the group and save will, but the U&Es won't because our patient is not less than 6 months old. Samples should be taken in the usual way. You will now be ready to label the samples. First, you need to print the labels. Each specimen does have a button to print its individual label, but as in this case, when you have multiple samples, it's quicker to use the button at the top of the screen and print all the labels. Next, you need to select your label printer by matching the printer name to your nearest label printer. Usually this will be mounted on the back of each workstation on wheels. Select your printer and then select Print. The labels will print out. Note in this example, although we have 4 specimens and we requested to print all the labels, only 3 labels are printed. This is because blood transfusion specimens, in this case a group and save, must be hand labelled in keeping with long-standing national guidance. Also note each label is unique and must be attached to exactly the correct bottle.
So having taken my samples, I'm now going to label them, just ensuring that I choose the correct label for the correct bottle. So looking at the first label, I'm going to date and sign. And then selecting it, this is my haematology sample, my lavender bottle. So I put it onto the bottle with the barcode at the top. Just ensuring that it's in place. I'm now going to label my group and save bottle. As you know, these do not come out of the printer but have to be handwritten.
Details for the bottle can be found on the screen or copied from other labels you've printed. The group and save sample needs a requisition slip printing. To do this, from the drop-down menu for the sample concerned, select Print and then Print Requisition. This time you'll be looking for the number of your Ward A4 printer. Select it and then press Print. Your requisition slip will print out. Note the fields on the bottom left of the form which must be completed in full.
Finally, for the group and save, I need to print a request form which needs to be completed at the bottom with my name, signature, today's date and bleep or extension number.
The final step is to mark our samples as collected. This timestamps the collection and removes them from the specimen collection window. This ensures that when the samples are reported, there is a time against the associated result. This is especially important for time-related samples such as troponin, antibiotic levels and clotting samples. Without it, all samples will be resulted to midnight, and this will make result interpretation particularly difficult. In addition, marking the samples as collected ensures that they are not inadvertently recollected by another practitioner. Mark the samples as collected as shown here and then sign. The specimen collection window is now empty. Send your samples to the lab in the usual way. In summary, always positively identify your patient when taking samples. Wherever possible, scan the patient's wristband to ensure that you're in the correct record and have the correct patient. After taking samples, print relevant sample labels. Stick labels onto the bottles, taking care that you get the correct label on the correct bottle. Don't forget, blood transfusion samples must be hand labelled. Print and complete requisition slips only if necessary, and remember to complete all the fields on blood transfusion request slips especially. Finally, remember always to mark your samples as collected to 1. Timestamp the collection, and 2. Ensure that samples won't accidentally be collected again.